Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us today. Our guest in studio is Ann Glauber, and she's a cancer survivor, specifically a survivor of pancreatic cancer. With more than 53,000 people being diagnosed with pancreatic cancer each year, it's one of the most lethal forms of cancer, and she's with us today to talk about the Let's Win crowdsourcing platform that's allowing researchers, patients, and doctors all to come together in order to get information, groundbreaking and new information regarding pancreatic cancer. Welcome to Health Professional Radio today, Ann.
Thank you, and thank you so much for having me here.
Thank you for returning. You know, when we were here before, we talked a little bit about your background, your diagnosis of pancreatic cancer, and also about the Let's Win crowdsourcing platform. For our listeners who may not be familiar with your story, tell us how you were diagnosed with pancreatic cancer.
Well, 2.5 years ago, I was a busy professional with a full-time job, and had just published a book and enjoying my life. And I happened to have made an appointment to see a dermatologist. And during that appointment, the dermatologist put a mirror up to my face, and we both gasped. And when we saw that the whites of my eyes had turned yellow, and he looked at me and said, "I think you have to see your doctor." And I left the appointment immediately, and I got a blood test, a sonogram, and a CAT scan, and then the horrible diagnosis that I had stage 4 pancreatic cancer. I had no symptoms and no signs of the disease, and that's typical for most people because the symptoms of pancreatic cancer can be very vague or nothing at all.
Now, Ann, you're a PR professional, and your work
Right.
has earned you a bit of national recognition for some, I guess, innovative communications models, specifically mobilizing the private sector to address public problems. Now, pancreatic cancer is an obvious public problem. You've spearheaded Let's Win. It's a crowdsourcing platform. It launched earlier this year. Talk about how Let's Win enables researchers and patients and doctors to get information that may not be readily available when someone's trying to, scramble to save their life.
Yes, when I was diagnosed, my family and I and friends, all went on the internet to begin to figure out what to do next, and it was extremely difficult to find information. We saw the terrible statistics about the disease, but it was difficult to find information about who were the pancreatic cancer specialists, what were the treatments that were being used, what were effective treatments, and what institutions really were specializing in this disease. So because I had such a difficult time finding information, that was one of the reasons that I co-founded Let's Win, because we wanted to put information all in one place that would help patients find their pancreatic cancer specialists, understand what many different kinds of treatments could be available for them and what their options are. So Let's Win was created really to educate and empower patients and families to try to take control of this diagnosis and not feel so discouraged and resigned when they heard this. The Let's Win site has stories that pancreatic cancer patients write about and talk about in terms of their treatment and what's worked and what's been effective. It has a promising science section where we report on new, innovative science that's happening in the labs and institutions that can perhaps help patients right now. And we have a really great clinical trial section that highlights clinical trials in a language that people can understand, so patients can take this information to their doctors and discuss it with them and say, could this be the right clinical trial for me? Can you help me pursue information about this clinical trial? So we want to provide this kind of information all in one place that will empower patients and families.
How difficult was it for you to coordinate all of these different resources and specialists and people with different levels of knowledge about the disease. How difficult was it for you to get everyone to cooperate and go in one direction to launch Let's Win?
I worked with a wonderful, wonderful team of co-founders. Dr. Allison Ocean from New York Presbyterian Weill Cornell, who is my doctor, is a co-founder of Let's Win and head of the Science Advisory Board. And she was able to invite the top, most prominent and prestigious scientists across the country working on pancreatic cancer to be part of our Science Advisory Board and to submit information about their research to our Promising Science section. Our other co-founder is Willis Shallett, who has been involved in social change for most of her professional life. She's an outstanding communicator as well, and she was responsible for developing the website for Let's Win, creating the platform, and working with us to put it together. Our other key partner is the Lustgarten Foundation, which is the country's largest private funder of pancreatic cancer research in the country. Let's Win is an initiative supported by the Lustgarten Foundation, and we work closely with them every single day to vet the articles that are on the Let's Win site and to ensure that we have the most important and recent scientific information on our website. We've also been able to hire and work with an excellent executive director for Let's Win, Cindy Gavin, who's enabled us to put all the pieces together. So I'm really fortunate that I have this wonderful, outstanding team that works hard every day to make sure that Let's Win is relevant, up to date, and could help patients as best as possible.
How often, if at all, does the Let's Win crowdsourcing initiative reach out to our learning institutions as in regards to pancreatic cancer? What about some of our learning institutions that are engaged in cancer research?
Our members of our Science Advisory Board are representative of many research institutions from across the country, and major hospitals from across the country, in Johns Hopkins to Memorial Sloan Kettering to MD Anderson. We are represented very well across the spectrum of educational institutions, academic institutions, and major hospitals. So our Science Advisory Board really reflects the diversity in pancreatic cancer treatment and taps in really the best scientific minds who are working on this disease.
Let's talk a bit about some of the costs that are going to be discovered once you engage on this research about pancreatic cancer, being a patient or maybe a doctor who's maybe has their first patient that's been diagnosed with pancreatic cancer, and they're trying to learn just as much as the patient, just as quickly. Talk about that, if you would.
Yeah, you raise a really important point because I have not talked about this. You know, we've talked about the importance of Let's Win to patients and their families. Let's Win also plays an enormous role for doctors as well. There are many oncologists across the country, thousands of them, who see pancreatic cancer patients, but they're not specialists. And maybe they're, community oncologists, and they have a whole range of patients that they see. And so they can benefit enormously from the information that we have on Let's Win, because what we do is we provide information on clinical trials, we provide information on a variety of treatment, and if doctors see this and go on Let's Win, they could be informed and educated as well and have the opportunity to discuss the treatment information with the doctors and specialists highlighted on the site. So it's really a way to educate doctors as well and keep them up to date and informed about the latest treatments so that their patients can benefit fully.
Well, I sure thank you for coming and joining us again today, Ann.
Thank you so much for having me again and for enabling me to talk about the importance of Let's Win.
And where can our listeners go and join Let's Win?
www.letswinpc.org.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in studio with Ann Glauber, pancreatic cancer survivor, PR specialist, and author. And she's been in studio with us talking about the Let's Win crowdsourcing platform that brings patients, doctors, researchers, and anyone who's looking for information about pancreatic cancer all together in one place. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.